So my name is Megan Barrett. I'm a marriage and family therapist as well as a certified sex therapist. Fairly new to the area of Rochester. Moved from Oklahoma about 2 years ago. And it really has been a wonderful gift to find the Rochester Center for Sexual Wellness to be amongst other clinicians and providers that are passionate about sexual health just as much as I am. Is just a wonderful thing to be a part of, as I'm sure you are all hearing through the topics that we're discussing today. So sex therapy came into the picture post-grad school after kind of my foundation of really wanting to work with relationships. And as Dr. Krantz had kind of mentioned, and some of you probably are aware in the mental health or medical field, that the sexual health portion is kind of this, either it's touched on, skimmed over, but it's not a big invested part of what we talk about, and it's really unfortunate because it's an integral part as we as humans and the relationships that we have. So becoming a certified sex therapist is just truly rewarding. It's rewarding to work in a clinic that supports and is invested in gaining new information about sexual health. We're constant in a state of discovery, which is exciting. And we work with clients from unique backgrounds, and their journeys are all very different and personalized to their needs, their wants and desires. So I hope all of that is kind of reflected in what I talk about today. So next slide. So when does relational therapy become a possible tool for people? As you can see here, there's a list of various sexual health and relational stressors that may lead people to therapy. I wanted to highlight this as a list as common concerns, yet also a note that this is a snapshot and doesn't really include all the reasons people may benefit from relational and sex therapy. I'll also note some of these common concerns in which people seek therapy may not include a sexual concern per se. However, through intimate conversations and dialogue about the self, about relationships, and sexuality just becomes a part of that conversation, just as spirituality, medical history, family history, the list goes on. It just becomes a part of that whole person's narrative. As Dan mentioned in the first module, the Plicit model is a very useful tool that we use. This allows people permission to talk about their sexuality. And this may be the first time they ever have been openly discussing with another person about their sexual experience and narrative, which is a very powerful thing to be a part of with people. It's about celebrating, or it's about exploring its complexities, and it's just a really important piece to relational work. Next slide. So we've kind of talked about what could be potential concerns or stressors that bring people into relational therapy that incorporates sexual health discussions. But it's also really important that we don't jump to conclusions of what the problem is for the client or isn't for the client and the relationship. Hence being aware of premature evaluation. For example, just because you have a male that expresses part of his sexual experience is maybe a long-term challenge with erectile dysfunction, or a woman that you speak with shares that she's not experienced an orgasm in her life. This doesn't necessarily mean that this causes distress to the individual or the relationship. So we really need to be mindful of what the client or the relationship is bringing to the table of what's a concern for them. Again, it's kind of checking that self of the therapist is really important. As sex therapists, we understand that sexual pleasure comes in many forms, is not reflective on how we do sex or how we have sex. It's about the meaning and pleasure one gains from that sexual experience. And as one of my favorite educators, authors, sexologist, Emily Nagoski states, pleasure is the measure. And I really do hope that I exhume that energy when I'm working with clients. So how do we make sure that we're taking on a client-centered approach when we're exploring the client's problem or a concern that brings them into the office? We use a sexual history assessment tool. Again, I think all of us have kind of touched on that. Dan, Lori, and Dr. Krantz, that biopsychosocial sexual history that explores the individual's sexual narrative. It starts from early childhood experiences through adulthood. It's including cultural and spiritual family influences that truly inform and formulate this current sexual narrative, which is important for us to know when we're talking about a concern or a distressor regarding sexual health. So we have to be very, very intentional about taking time and getting to know all this information. Next slide, please. All right. So once we've gained information through the sexual history assessment, then we move towards clear and defined therapy goals. And this is something that I'm very intentional about, and meaning that this is something that I openly discuss with my clients, whether I'm working with an individual or a relational system. We're intentional about this portion in therapy and exploring what is it that they want to work on, what do they want to gain out of this experience, and how do we know when therapy is done? You know, and most importantly, how do I make sure that I'm on the same page as the people that I'm working with? I like to say, you know, how do I know when I can be laid off, right? How do we know when we're done with therapy? What does that look like? And because I think when people come into therapy, they're tired, they're fatigued with whatever concern that they're dealing with, and they want relief, they want healing, and so having that on-site of this is what we're working towards, how do we know we're there, can be a very empowering way to look at it. Next slide, please. So another important concept of formulating relational goals is making sure that clients have mutual investment in their goals when they're coming into therapy. And some of you may know, there's some therapists out there, if your clients aren't invested in therapy goals, then you're most likely going to feel stuck in therapy. So the question is how do you represent the complexities and the differences each party may want to work on in therapy? For example, if you have two individuals coming in from varying different beliefs or comfort levels with a particular sexual behavior, for example, the use of sexual media or porn use. If one partner's goal is to eradicate porn from the relationship, yet the other partner really doesn't have an intention of stop using sexual media as a part of their sexual expression, it's going to be problematic in therapy if a goal is to stop porn use, as it's not a mutual representation. And so you have to take careful time to maybe formulate goals that can be constructed in a more useful way that is more inclusive of everyone in the relationship. Some examples can be, how can the relationship formulate healthy conversations surrounding sexual health? It's going to be a real big challenge for a lot of relationships, couples, and this is a new foreign concept. They talk about bills and parenting logistics, but really this is an uncharted territory to talk about sexuality and sexual health with their partners. Seek understanding and curiosity versus judgment. expanding knowledge about their own sexual narratives that may differ from their partner, and the list can go on. But these types of conversations and goals in therapy can really enrich and deepen intimacy in a relationship versus focusing on specific problematic behaviors that may keep a couple or a relationship stuck in perpetual problems. Next slide, please. So I think with all of this being said, doing relational work, whether you're working with a relationship, a monogamous relationship, non-monogamy, polyamory, or just a variety of relational constructs, it's really important, if not absolutely critical, to be able to balance and honor all the moving parts, as you see here on this diagram. Holding space for each part of just the relationship, the individual, and the sexual health components really allow for a more inclusive and expansive conversation that really can maximize the potential for growth and healing.